Non-suppurative otitis media by Nestle Shah. Types of non-suppurative otitis media. We are going to talk about otitis media with effusion and adhesive otitis media. What is secretory otitis media? All otitis media with effusion. It is the accumulation of a non-purulent effusion in the middle ear cleft, which is the most commonest cause of conductive hearing loss. Why this happens? Because when the Eustachian tube is obstructed or there is a dysfunction in the Eustachian tube, this leads to improper middle ear ventilation and causes the development of negative pressure. On the other hand, the mucosa tries to equalize the negative pressure by producing an effusion. Effusion consists of exudate from the blood vessels and mucin, which is from the mucin glands and the goblet cells. Secretory otitis media. Etiology. Obstruction of the Eustachian tube, which can be caused of anything in the nasopharynx, including edema, hypertrophy, or tumor. Otitic paratrauma is also a cause. Muscle dysfunction of the Eustachian tube can happen in cases of cleft palate or paralysis of the soft palate. Inadequate treatment of acute otitis media in the form of low dose or short duration of antibiotic does not cause complete recovery. Clinical picture of secretory otitis media. The patient will complain of hearing loss or tinnitus. On examination, we can see that the drum is retracted. There is foreshortening of the handle of Malleus. Lateral process of the handle of Malleus is more prominent. Distortion of the cone of light, and the mobility is restricted. In the middle ear, we can see effusion. The drum will be colored from yellow to dull gray. There will be a hairline appearance due to the fluid level in the middle ear, and also we can find air bubbles present in the middle ear. By examining the hearing using the tuning fork tests, we will find that the patient has conductive hearing loss. Investigation of secretory otitis media in the form of pure tone audiometry will show conductive hearing loss, and tympanometry will show a flat curve, type B tympanometry, which is diagnostic. Treatment of secretory otitis media or otitis media with effusion. First, there is conservative or surgical. Conservative treatment of the predisposing factors, whether it is Eustachian tube obstruction, cleft palate, or further. Antibiotic therapy to prevent recurrent infection, autoinflation of the Eustachian tube by chewing or Valsalva maneuver, corticosteroids and mucolytics. There is a controversy in both of them. Surgical treatment in the form of laryngotomy and insertion of a ventilation tube, whether temporary or permanent. temporary in the form of a grommet tube, and it stays for 3 to 6 months, while permanent is a T-tube, and usually it is not inserted except if there is complete failure of conservative treatment for several weeks. This is to substitute the function of the Eustachian tube. Adhesive otitis media. Due to presence of fibrous adhesions in the middle ear. It is due to inadequate treatment of secretory otitis media, organization of the middle ear fluid leading to formation of fibrous adhesions. Picture of adhesive otitis media. Hearing loss and tinnitus are the main complaint. Symptoms, we can see retraction of the drum, and the color of the drum is dull gray. Also, like secretory otitis media, tuning fork tests will reveal conductive hearing loss. Investigations of adhesive otitis media. Pure tone audiometry will reveal conductive hearing loss, and the tympanometry will reveal SA type. Treatment, operative or hearing aid. Operative, tympanoplasty and lysis of the fibrous adhesions, and the hearing aid if necessary. Thank you and good luck.